Who do we have here in the audience that are with magazines related to children or teens or tweens? Or good, you all really need to listen to what I'm going to talk about now, because we're going to turn our attention now to the youth in our survey. And I think the results from the youth in our survey are pretty alarming. I think they're pretty alarming for normal weight children, but they're certainly very alarming for children who are obese. For example, of normal weight children, about a third of them report having difficulty with sleep. But for children who are overweight, almost half of them report sleep disturbance at night. If we look at another physical symptom of headache, some 43% of children who are obese report problems with headaches, compared with only 28% of normal weight children. When we look at eating patterns, we see problems in normal weight children at an incidence of only about 16%, but in our overweight children, almost half of them. And we see some emotional kinds of symptoms more disproportionately in overweight children as well, with over a third of them reporting that they just don't feel like doing anything, which can be a symptom of depression, and with some 22% of them reporting feeling angry a lot or getting into fights. We know that about a third of our children are overweight or obese, and that these figures are very much in line with national figures, and you'll hear some more about that from Dr. Henderson in a little bit. And these children are more likely to say that they worry. They are more likely to have emotional kinds of reactions to stress, and they are more likely to have physical kinds of symptoms as well. So these physical and emotional kinds of symptoms that Dr. Anderson mentioned is occurring frequently in adults who are stressed out. We're also seeing these same kinds of symptom patterns now show up in children or in teens, and as well as in even younger children. And they do report a wide range of symptoms related to stress. What do kids do to feel better when they're worried or stressed? Or how do they learn how to deal with stress? The data's shown us for years that many of the ways that adults use to deal with stress are ways that, while the behavior itself, let's say reading, for example, in and of itself is not problematic, but the problematic part of it is that it's a sedentary kind of activity, and it doesn't do anything to get your engine going, get your metabolism up, and get you to burning calories. So these sedentary kinds of activities, while not bad in and of themselves, but if in the improper balance and they outweigh more physical activity, they can have long-term negative effects. And what we all know, those of us who've been parents and those of you who are going to become parents, is that parents are teachers, and children learn what they live, and they learn from the kinds of examples that they see set in the home. There seems to be a real disconnect between the healthy behaviors that parents say they value. If you talk to parents, and even in our survey, they say that eating healthy foods is important, and they say that exercising frequently and being active is important. But the disconnect term that Dr. Anderson used is one that shows up here as well, because they also say that it is very difficult for them to get their family members to engage in activities that are more active, less sedentary, and have a better outcome on health. And when we look at overweight children as compared to children of normal weight, particularly in regard to the kinds of things that they do when they feel stressed or worried, what you'll see here is that they tend to do two things that are much more sedentary in regard to normal weight children. That is, they nap more and they eat more. But they play sports and exercise less. So again, the more activity, the better for the health in the long term. Learning early in life some better long-term kinds of strategies for dealing with stress, and not relying solely on sedentary strategies, can certainly, I think, have better outcomes for children. We have a growing rate of obesity in this country that we've seen a lot about in the news lately, and currently nearly 1 in 5 children in this country is obese. Stress, we know, is hurting American families, and I think some of the data here is particularly important to point out. We know that there is a definite relationship between the parent's stress level and the level of stress or the level of emotional discomfort that is felt by children in response to their parents' stress. Our data also shows, and we had some data similar to this last year, that parents tend very much to underestimate their child's awareness of their own parental stress. In fact, most parents are kind of clueless when it comes to that. I think it's because as parents we try to insulate children and hope and believe that we do insulate children from the bad things or the stressful things that are going on in life. But the data suggests that children are very much aware of what's going on with mom and dad, and very much aware when their parents are stressed out. And that children who say that their parents are stressed a lot are 8 times more likely than children of unstressed parents to report stress themselves. So we have a much higher rate of stress-related kinds of problems in children who have highly stressed parents. And only about 14% of the youth in our survey said that when their parents were stressed, it didn't bother them at all. So what that means is that when parents get stressed, 86% of kids are bothered and worried about that. About 86% of children reported that their stress bothers them. Many of them feel sad, worried, and frustrated. The emotional toll seems to be greater in terms of the frequency with our teenagers than with younger children, so that may be a good thing. But teenagers in particular point to being very worried, frustrated, agitated, and annoyed when their parents get overly stressed. 1/3 of children say they know their parents are worried or stressed when they yell, and 9 out of 10 children say they always know when their parents are stressed because they argue, yell, and complain. Does that sound like any of us lately when we get stressed out? Now, the good news is that most young people say that they feel at least comfortable, if not very comfortable, talking to their parents about these kinds of issues. Not surprisingly, younger children feel more comfortable about that than do teenagers, although teenagers feel comfortable enough to want to talk with their parents about some of these things. Parents also feel relatively comfortable, and so I'm not sure what the disconnect is, that they're not kind of getting together and talking about these things. It may just be the accumulated impact of stress, the fact that they're all very busy, the same things that get in the way of finding time to exercise more and to have healthier meals may be some of the same kinds of factors that are contributing to the lesser communication than we would like to see between parents and their kids. It's very important, I think, for parents to learn how to help their children identify stress, how they act and behave and when they're stressed, and to begin to model the kinds of behaviors and emotional patterns that are important for children to learn.